All right, so we are on part 4 for our law PowerPoint here and discussions through. We made it through 1 week, okay? We're into the second week of law. So we're going to start on slide 23. So this slide starts with the Anabolic Steroid Act of 1990. So this act was put in place because there was a lot of illegal selling and using of anabolic steroids, you know, not just within the United States and communities, but also in the professional athlete setting. So everything from professional wrestling, football, baseball, had a lot of people who were using illegal anabolic steroids to increase their muscle mass and their strength. And it wasn't just males, there was females as well. So once this went into effect, most of the professional athletic organizations, NFL and the Major League Baseball, all of that, the wrestling, even the Olympics, they do testing to make sure that you are not, that the athletes are not using any anabolic steroids. The Omnibus Budget Reconciliation Act of 1990, also known as OBRA 90, this act actually requires pharmacists to review patient profiles and offer counseling for all Medicaid or Medicare patients. So if they do not, CMS, which is the Center for Medicaid Services, will not reimburse for those prescriptions. So that's why it's important that pharmacy technicians are consistently asking patients for, you know, if they want counseling or not. They can decline it, but they must show a signature for declination, because they have to show, especially if it's a patient that is you know, has Medicaid, or in what Arizona we call access, or Medicare insurance. The Omnibus or the OBRA 90 requires that counseling. The Dietary Supplement Health and Education Act, or DSHEA, as I like to refer to it, of 1994. So this is where you're going to kind of see the difference between what the FDA regulates as far as over-the-counters, prescription drugs, and homeopathics, and what they don't oversee for dietary supplements. So dietary supplements manufacturers are not required by the FDA to prove efficacy or standardization. They only have to prove that the supplement is safe to use, and they have to make truthful claims. So they cannot say this is a cure-all, this is a magic elixir, that type of thing. So they have to prove that it is safe, but they do not have to prove that it is effective or that it's standardized. So dietary manufacturers or supplement manufacturers are banned from making the claims of curing or treating different ailments. And the FDA, even though they don't regulate dietary supplements, they can remove dangerous supplements from the market. So I'm just going to put here on the board, because I want you to remember this. You can see that. All right, so you can see here, I broke it up into a chart. So the FDA oversees over-the-counters, prescription, and homeopathic drugs. They must prove safety and efficacy, okay? DSHEA oversees dietary supplements. The FDA does not. They must only prove safety and no false claims. So again, no cure-alls, doesn't cure, doesn't treat specific ailments. But the FDA can they can in turn remove dangerous products if there starts to be a trend with a particular dietary supplement out on the market that's causing harm. So for example, and I think I've talked about this once before, there was a tea shop in San Francisco that was selling a particular type of herbal tea that was derived from a root of a specific plant. And if it wasn't boiled and done properly, it was toxic. And they had a lot of people, they had a good amount of people, 10 to 12 people that died as a result of being poisoned by this particular tea. The FDA doesn't oversee that, but when that started happening, they stepped in and removed it from the market because it was no longer considered safe. HIPAA. And this is huge. So you're going to be having an upcoming assignment on HIPAA. So the Health Insurance Portability and Accountability Act, known as HIPAA of 1996, one of the most important things to come away with this is that the HIPAA ensures patients can move health insurance and from one employer to another without denial for pre-existing conditions. So prior to this law being passed in 1996, it was really sad. People that had chronic health conditions, diabetes, heart disease, lung disease, even genetic disorders, if they were employed by one employer and had insurance and they left and they tried to get insurance through another entity through their employer, the insurance company could find out if they had a pre-existing condition, and if they did, they could deny them insurance access. And so we had a lot of patients during that time leading up to 1996 that didn't have health insurance coverage because they were denied for pre-existing conditions. So this was another good part outside of patient privacy protection and protection of their protected health information that came about from the HIPAA. So also, patient records must be kept confidential. That is a responsibility of every healthcare entity out there, not just hospitals, not just doctors' offices, but pharmacies as well. Every time you have a new patient, okay, so if you have a new patient that has never visited your pharmacy before, they're going to have to fill out your facility's privacy information sheet and sign and acknowledge that. That is law. That is 1996, and that is required. We as staff are required to protect their information. We cannot just throw pieces of paper or labels or bottles that have their personal information on it in the trash. These things must be shredded. They must be blacked out and torn apart, incinerated. So different options, but we can't just throw them into the trash. There was actually one of the best examples I like to give for the HIPAA was actually a situation that happened right here in Tucson. So it's not just having access to physical forms, papers, insurance cards, that type of thing of your patients with their patient information. If you work in a hospital setting, when a patient is brought in, they have an electronic health record, and that's where all of the doctors will put their notes in, the nurses will put their notes in, pharmacy puts notes in, pharmacy puts in the prescriptions, the labs will put the lab results of all the blood draws. So it's an entire patient record, right? Their chart inside the computer system. So when Gabby Giffords and her constituents were shot here in January, I believe it was in 2011, there was immediately media hype all over the situation. So what UMC did at the time was, as soon as these patients started arriving at UMC, particularly Gabby Giffords, they started watching her chart. And so when you work at a facility and you go through your onboarding and your orientation, they're going to give you a login and a password to their computer system. Their IT can track that. Their IT can look at your login and find out whose chart you've been in and which parts of the chart you've actually accessed. So they found that individuals that had no business being in Gabby Giffords' chart were accessing it. They found that through checking her chart and seeing who was getting in there. And they found a couple individuals that worked there were trying to sell her information and statuses on the update on her health to the media outlets. And they were terminated immediately, no questions asked. So I think there was a handful of employees at UMC that got busted that way and were terminated for violation of HIPAA. So the important aspect to walk away from this from is, you know, we could have a high profile patient. All right, there's a rehab facility called Sierra Tucson that's out north in Oracle, and it is a very luxurious rehab facility, and a lot of times celebrities and athletes and different people of fame go there for treatment. And you know, regular individuals like us work there in the pharmacy and nursing and all of that. And so we have to make sure that we do not disclose their information. You know, you cannot come home and say, oh, guess what? You know, so-and-so from this show was at Sierra Tucson getting help and treatment for drug addiction. That's a violation of HIPAA. The same thing goes as, you know, if you're working in a facility and, you know, you see your ex-girlfriend or ex-boyfriend come through and you're just curious to see why they're there, you can't do it. Okay, that's a violation of HIPAA. Rule of thumb is you only will access parts of the patient chart that you need and you have the right to be in. So for pharmacy, that's anything pharmacy related. Okay, we can look at labs. We can look at patient history. We can look at their allergies. We can look at those things. We have no business being in nursing notes. Okay, we don't need to be in there. We have no business being in dietary. Okay, we have no business being in there. So rule of thumb is if you have to access a patient's chart, you're only supposed to access the areas you need to complete your job. Okay. The Food and Drug Administration Modernization Act of 1997. So this was a pretty neat one because it streamlined the drug approval process so drugs could actually make it to the market faster. It added a new requirement that biological drug products undergo the new drug approval process. So any drugs that are considered of biological nature have to go through the same approval process by filing a new drug application. This act actually also put a little bit of restrictions on compounding pharmacies. It allows compounding pharmacies and pharmacists to exist. It allows them to compound any item or product that is not commercially available. What that means is that the patient just cannot go get that prescription filled at a regular Walgreens or Fry's. It has to be a specialty item. So we're turning a 30 milligram capsule into a 10 milligram dose because a 10 milligram dose doesn't exist. Or we're turning that capsule into a suspension for a child because they can't swallow large capsules. So something that any prescription that is not already bulk manufactured or made by a different manufacturer, it has to be a specialty item. The Medicare Modernization Act, or the MMA of 2003. So this act actually added the drug insurance coverage known as Medicare Part D. Medicare Part D is an elective part of Medicare, and it does have a separate insurance or a separate premium. So it's not for free. They do pay a separate premium on that. They made it accessible to all patients who are eligible through Medicare and who want it. So they elect yes or no. It prompted a variety of federal and state and federal private plans. So some of the states locally have their own plans specifically to Medicare Part D. Insurance plans compensate pharmacists for performing in-depth reviews of Medicare patients' medication profiles, which is known as Medication Therapy Management, or MTM. Excuse me. So these insurance companies are ensuring that the pharmacist is really doing an in-depth investigation. They're looking at everything that the patient is taking, everything that they're allergic to. and they're looking for ways that they can condense the amount of medications they're taking, but also prevent anything like food-drug interactions, drug-drug interactions, and things like that. It also allowed, and most people don't know this, this might help you on one of your questions for the assignment for today. So this act actually allowed the development of health saving accounts for patients who are 65 and older, okay, which was something that didn't happen before. The last piece we're going to cover here is the Combat Methamphetamine Epidemic Act of 2005. So this was in response to products that contain pseudoephedrine or ephedrine. The brand name for pseudoephedrine by itself is called Sudafed. These were used to illegally manufacture methamphetamine or street meth. So all of the meth cooking or cookers were using large quantities of pseudoephedrine and ephedrine containing products. That was one of their main ingredients in the making of illegal bootleg meth. And so to kind of combat that and get some of these labs shut down, they passed the Combat Methamphetamine Epidemic Act of 2005. So what does that mean? It restricts the sale of products with pseudoephedrine or ephedrine containing medications that are used, you know, in most common cold OTC items. So when you see something like Claritin D, the D represents the decongestant, which is the pseudoephedrine. So Sudafed, Claritin D, Mucinex D, okay, so it has Mucinex, which is guaifenesin, but also has the D, which is the decongestant, which is the pseudoephedrine. All of these items must be stored behind the counter or in a locked container, a locked box. The sale is restricted to a certain amount of grams that a person can purchase in a day and a certain amount of grams that a person can purchase in a single 30-day period. I'm not going to give those to you. You must search for those in your chapter 9 because that breaks that down a little bit more. So in chapter 9 you will look for that. But requirements for us is that it has to be locked away now. So people can come and ask for it. And when they do that, we're getting information from them. So some of the pharmacies have a sophisticated system where you just scan their driver's license and it inputs all of their information in, and that's how we keep track of how much they've purchased in a day or a 30-day period. And then there's those pharmacies that don't have that computer system and everything is done on a logbook. So you're going to ask for the patient's driver's license. They must be 18 years or older and they must provide valid proof of that. And then you're going to write down the information. You're going to write down their name, their address, their date of birth, and the quantity and stuff that they purchased and the date. And so when you have another patient that keeps coming back and keeps coming back, you're going to cross-reference that and make sure that you're not selling over the allotted amount per day and the allotted amount per month. All right, so we are at slide 27. So you are going to review from slides 23 to 27, and then I will put up the chapter readings on your folder for the day. If you have any questions, be sure to call me or email me, and hope you have a good day.